Welcome to Fun with ECGs. "30 seconds to look for evidence of ischemia." You will notice that the rate is fast and you can also diagnose the rhythm. I'm more interested in the ischemia, but I will explain the rhythm briefly. The rate here is 138. I don't get too bogged down in the arrhythmia. We have got some organized looking atrial activity here, but it is an irregular baseline, and that would make this atrial fibrillation. You can get this appearance in V1, and we could argue about what exactly the rhythm here is, but the point of this is that we have rate-related ischemia. There's a normal axis and a normal QRS duration. Now we have widespread T-wave inversion in the infralateral leads, and we have 2 millimeters of ST depression. There are no Q waves and there is no loss of R wave. The question here is the atrial fibrillation new, in which case tachycardia due to new AF might be causing ischemia, and the patient might have underlying coronary artery disease, which may not need any treatment if other than secondary prevention, assuming that the atrial fibrillation, the tachycardia, is the cause of the problem. On the other hand, it may be the patient has long-standing atrial fibrillation and the ischemia and pain is causing the tachycardia and exacerbating the problem. So the diagnosis here is a moderate degree of rate-related ischemia. The patient needs to have rate or rhythm control and GTN, and then consider if the ischemia is causing the tachycardia or the tachycardia is causing the ischemia. Rate-related ischemia comes in lots of different forms. This is a moderate level of ischemia, which certainly needs urgent action and careful clinical assessment. Obviously, don't treat patients just based on the ECG. This is another example. This is showing very extensive ischemia, including marked ST elevation in AVR. So this sort of a tachycardia and ischemia would leave you very concerned the patient is going to become unstable and they need to be urgently assessed and urgently treated. Thanks for watching.